Hey, what's going on, everyone? I am out walking my dog, and I decided I would talk about a topic that could be a Facebook Live, and then you might be even hearing this on a podcast episode. But before I even get rolling, the stuff I'm going to talk about is inside of our book, Move Well Secrets, where we talk about a lot of these concepts that I'm realizing are really obvious to me now because I live it, breathe it, talk about it with patients every day. Our staff knows it like the back of their hand. But I realize when I first learned them or started putting them together, making sense of it, it was a pretty awesome concept to figure out. And it was kind of a little bit of an aha moment. So I want to share it with all of you, whether you're watching this on live or later, because it's late here. It's past 10 o'clock. What time is it? 10:06 p.m. And I'm walking my dog. This is my warm-up, actually. Then I'm going to go do about an hour and 15-minute workout in my home gym that I have built out. It's a pretty awesome home gym. Might I add pretty much everything you'd ever need in a gym to post some pictures up sometime soon. I built it with the intention of not just working out, but having a place where I can film videos and stuff for Move Well, Move Now. So, anyway, the thing I wanted to talk about on this, grab the book if you haven't already. Go to book.movenowyou.com. And I listed that up above. So you can click on that link and you can grab the book for free. Just cover shipping. We'll send it off to you. We've been sending lots of these off every week, getting lots of good feedback from doctors, instructors at schools, everything who are digging it, which is really cool. He said so eloquently, so simply, was from Gray Cook in Functional Movement Systems. And he says, first move well, then move often. Always address mobility first, then stability. So there's all these little rules to follow. But what does that really mean? Because it actually flies in the face of how a lot of other people put together movement or rehab or whatever. And it's that what you want to do is, if someone can't move, like if they don't have proper joint action, you're trying to improve their movement, you need to work on figuring out what tissues are limiting them to move. So let's say in the common scenario that we talk about is bending over to touch your toes. If you can't bend over to touch your toes, why is that? You tighten your low back, you tighten your hamstrings. Do you have some kind of joint issue in your hip or your spine that's not allowing you to go into that forward flexion position? So either way, whatever's restricting you from going forward, the last thing you're going to do is start with stabilizing exercises. Or, hey, let's work the core or the abdominal muscles. That's not how we're going to start. That is important, but that's not what we're going to start with. The first thing you're going to start with is figuring out, why can't the person bend forward? Is it joint? Is it muscle? Or is it a motor control issue? Meaning it's not a tissue or actual structural thing that's limiting their forward bending motion. It's that they can forward bend just fine. They just have to be cued and taught how to go through that pattern properly. Side note example, I have a patient last week. She's a personal trainer. She does a bunch of group fitness classes. Here's some dogs barking in the background. And she went to do her movement assessment, and she folded forward, and she could almost put her elbows on the ground. She completely folds at her spine. Her pelvis doesn't shift backwards at all, so her legs stay totally vertical. That is a dysfunctional movement pattern in forward bending. That's not supposed to happen. You're supposed to have a shift backwards in the pelvis, and then you're supposed to bend forward, have a uniform curve in your spine, and be able to touch the floor, touch the toes. So she thought she was so great because she could do that. However, she's super dysfunctional. Her spine is a mess. She's come a long way, actually, because she went through a whole level of corrective care with us a couple years ago, and now she's back again to continue on in care. So she's improved tremendously. However, that pattern hasn't been fixed, and she still has chronic low back issues. Why is that? She's moving dysfunctionally all the time. Okay, so anyway, I digress. So how do we get our patients or yourself to move properly? Here, I'll hold the camera like this, the phone, so you're not just looking up at me like this, seeing the sky. So first you have to address mobility. So let's say it's, you figure out getting the tissue to relax a little bit. Now, then you go into stability. Then you have to reinforce that pattern. Okay, so mobility, stability, and then you imprint it in the brain. That's the process. That's the 3-step process to make it simple. Now let's make it a little more complex. How do we break this up in our belt system of functional movement? So like the way we program out exercises, really the big part of Move Well University. It's going to take a while for me to get used to saying Move Now. And for those of you that don't know, we are going through a name change. We're rebranding as Move Now U, Move Now University, Move Now U. So we have a website, movenowu.com. Check it out. It's a new site. It's pretty awesome. But anyway, so now how do we go through this in our belt system of functional movement, where we organize a progression of exercises with our patients in a belt system, kind of like martial arts, like white belt, yellow belt, so on. You work your way up in complexity. Well, we have a 5-step approach that really follows the 3-step process that I just told you. Mobility, stability, and then reinforce. And then even better, you reinforce it with loading, like some kind of resistance or weightlifting activity. The tool of choice we use are kettlebells. All right, so let's break that down. There's a 5-step approach that follows mobility, stability, and then imprinting it in the brain or reinforcing the pattern. So for mobility, we break that up into 3 steps. We do global mobility using a tool like a foam roller, for example. What does a foam roller do? What does the research show in a foam roller? Does it break up tissue? No. Does it desensitize pain and in a workout setting reduce delayed onset muscle soreness? Yeah, there's a lot of studies that suggest that. Does it desensitize an area so that you can move without as much guarding? Yeah, and a lot of people it does. So the mechanism in which how it works is what has been misunderstood for a while. People think, oh, I'm going to break up scar tissue with a foam roller. It takes over 2,000 pounds per square inch to break up scar tissue. So you got to be pushing pretty darn hard with that foam roller, and you'd probably be doing a lot of damage to your body if you actually pushed with that much pressure. You need like a hydraulic press to do that. So that's not what it's doing. But it's desensitizing tissue and allowing the opportunity to start to move better with those tissues that are so taut, tender, and challenging. Then what we do, after we go for global mobility, usually using a foam roller, depending on what body part we're working on. Let's say the example of a forward bending motion, which is like an overactive posterior chain, okay, all the muscles in the back of the body. So we would do global mobility of the foam roller. We would do this in probably the pelvic region, thoracic spine, calves. Wouldn't do low back, because when you foam roll the low back, you usually guard too much. It's too big of an object to extend over on the ground. So for low back, you'd use a smaller height object like a double lacrosse ball. Works well to desensitize the tissue. And that goes into the next step of the 5-step process, which is focused mobility. So we go global mobility, then focused mobility. Both of those steps utilize some kind of tool. And we have a tool that we have our patients use at home and in office called the Move Well Home Mobility Kit, which includes all the stuff that I'm talking about for every body part that you need. So conveniently, that's how it works. Isn't that pretty in the background? All right, those of you on a podcast are like, what's in the background? Here at night, when there's a sunset, it just got dark here in Idaho. Okay, it gets dark very late here in the summers, which is kind of cool. Okay, so the next step, after global mobility, then focused mobility, then you have tissue extensibility, which is like stretching. I'm trying not to get wet here walking through sprinklers. I can't really see. Hold on one second. I'm here with my dog. All right, come on. Give you a chance to beat the sprinkler. The sprinkler's moving. Hold on one sec. There's a sprinkler coming at us right now, and we're on this path. My dog's like huffing and puffing and wants to get wet with the sprinkler. And I really don't want to right now. this other one, is it moving yet? Sorry, I can't focus on dodging the sprinkler like Indiana Jones and talking all this stuff at the same time. I think we're just going to run through it. All right, you want to run through it? Okay, go. Oh, that was cold. Whew, that was cold. All right, now I'm soaking wet. Okay, anyway, I don't know if you can see that on video. Definitely can't see that on podcast, but I got wet. Okay, so we got global mobility, focus mobility, then tissue extensibility, which is stretching. We like static stretching initially, but I like dynamic stretching as well, especially if you're going to start working out, doing some kind of loading. So some dynamic stretching after you do some static stretching. Most people start a workout trying to increase mobility with what? Stretching. They skip 2 steps that help desensitize the tissue and make it a lot more effective. So far we got 3 steps: global mobility, focus mobility, soft tissue extensibility. What is that? That's mobility in 3 steps. Then we have stability. What do we do for stability? We figure out what area of the body is lacking stability. So in the case of forward bending, it's usually core. Core is lacking stability. And the problem with lack of stability is that the body puts the brakes on the muscles, creates stiffness to try to protect the spine as you forward bend, as you forward flex. So now stability. There's some stability and activation exercises. You can do a leg lowering drill. You can do a toe touch progression. These are different ways of triggering motor control in the brain, also triggering stability while you flex forward. So it's retraining that pattern of not just like strengthening the core, but getting the timing down, which is very important. Okay, then you have the 5th step. After you have the pattern reinforcing, the 5th step is now loading. And loading is done with resistance. And it's using a big functional movement pattern, ideally. So what are those different patterns? Well, there's a saying that we have in our belt system of functional movement, is that all roads lead to deadlift. Deadlift is a great pattern when done properly, of course. Learning how to hip hinge, learning how to engage the core, having proper mobility first, making sure you're actually deadlifting off of the proper depth, depending on if you're 85 years old and you need to just go a couple inches down just to start with a loaded hip hinge, or if you're an athlete who's been training and possibly still not deadlifting all that well with all the different cues. We use kettlebells. I feel like a kettlebell is the best way to teach a deadlift initially. I do lots of barbell deadlifts myself, but a kettlebell deadlift is a great way to teach the pattern. Okay, and it's because you can bend and break the handle. Your hands are close together. It's easier to lower an object between the legs than it is trying to figure out the bar path with your knees and hitting into your legs and your shins and all that good stuff. So anyway, just to recap, this is actually a 5-step pattern that we take our patients through after the first couple weeks of care in office. When they're learning corrective exercise and functional movement, we use this 5-step protocol every single visit. We always end with loading. So we go global mobility, focus mobility, tissue extensibility. Those 3 steps right there is mobility. Then we go into pattern reinforcement, okay? And then we go into loading. And so those 5 steps are the secret sauce. That's what all the different gurus out there are teaching. We just put the systems together to actually make it happen. And we built out all the exercise protocols so that you don't have to worry about the programming, which is sometimes the hardest part, because if you're trying to do this in a chiropractic practice and you have staff that's assisting you or running the exercise department completely, teaching them what you know in your head is very hard to do. It's very hard to step out of there if you don't have systems. Or if you don't have this in your head to begin with, and this is like a foreign concept to you, what's the quickest way, the best way to fast track you learning this? It's going through the belt system. And that's all the stuff we have inside of Move Well, Move Now, You. So, with that said, I'm almost home now on this long dog walk. My watch just went off saying that I hit over a mile. So that's good. Maybe we'll start a new segment of Facebook Lives when I'm out walking my dog before I work out late at night. This is a new thing I'm trying. I was working out early in the morning, and I just find out with all the working out, lifting I'm doing, just too stiff in the morning. It's just easier to do it in the evening. I feel better. So that's how I'm doing it. Anyway, and Kaylee's joining us on here on this Facebook Live. How's it going, Kaylee? You should be sleeping. Kaylee is my assistant at the clinic. She's also going to be very soon, assisting us in the exercise department. So Kaylee, this is a good video to go back and watch because it talks about the 5-step approach that we use, which I know that you know, but you're brushing up on all this. So here's the first part of your training. Go for it. So anyway, with that said, if you haven't grabbed the book yet, you can grab it. The URL is in the subject line above. It's book.movenowyou.com, and we'll send it out to you. You just cover shipping, and you'll get the book hopefully within 5-6 days, something like that, maybe less, whatever. And I'm going to go. Wish me a good workout. Comment below. Share this with other chiropractors you think might benefit from it. I'm not going to get sprayed with a sprinkler again, so I'm walking out in the street, and we'll talk soon.